If you've ever had shoulder pain, this is how we treat it here. Shoulder pain is rarely an issue of one tendon or one muscle being irritated. So when we do these SoftWave therapy treatments for shoulder pain, what we always do is we start back here on the shoulder blade, hit all these trigger points that most people have, start to hit these rotator cuff muscles, and then where they attach to the bone over here where most people experience pain, we spend extra time here, and especially in front of the shoulder as well. There's so many structures and so many tendons that can be irritated when we have shoulder pain, regardless of whether there's a small tear or something going on in a particular tendon. We want to make sure we hit the entire rotator cuff and not focus all of our attention on one pain spot, because we could be missing something. So by the time we're done with the treatment, we could have really hit one spot when there might be 4 or 5 that we need to hit. So that's why every treatment we're going over this entire shoulder girdle, so that by the time you're done with a full-length treatment plan, we know we've hit everything we could have, and people tend to start getting relief after about 3 to 4 weeks of care.